Diagnosed with endometriosis about 2 months ago. Doctors discovered a 15 centimeter cyst on my right ovary. I had big problems being able to go to the bathroom. I mean, it would take about 2 to 3 weeks. I was really struggling throughout my business trip. I came back to Beirut and I got tested, and it turned out to be that I have this cyst around my right ovary. I came and I saw several doctors in Lebanon, and unfortunately most of them told me that my ovary could not be saved, so I'm gonna have to let go of my right ovary, which wasn't an option for me considering I'm quite young and I've never had a baby yet. So it was really important for me to preserve both ovaries. So I was quite persistent until I found Dr. Karim Naufal, who's just an incredible doctor, because the moment I entered his office, he told me, I'm going to try my best to save your ovary. And he did, as a matter of fact, save my ovary, which is just amazing.
I'm Dr. Karim Naufal. I'm a specialist in gynecologic surgery, laparoscopic and robotic surgery. We're talking today about endometriosis and endometrioma. Endometrioma is the presence of a blood cyst on the ovary that usually will not go on its own and needs to have a surgery. Endometriosis is very important because it does affect a woman's fertility. Like with Andrea's case, she had a very big endometrioma, meaning a big ovarian cyst that has blood. It was reaching up to 14 centimeters and causing abnormality in the fallopian tubes. This cyst would cause pain and definitely would cause problems trying to conceive. So in these cases, sometimes people would go ahead and do what we call an open surgery. An open surgery, which is a big cut in the abdomen, which sometimes causes more problem than it actually fixes. Some people would actually be at risk of removing the whole ovary, further making it more difficult in terms of fertility and getting pregnant. This is where the robotic surgery helped us with Andrea. We were able to do this robotically, meaning with very small incisions. We removed the whole cyst without harming the ovary whatsoever. We did not need to affect the fallopian tubes, thus preserving the fertility and removing the pain and the reason that caused the blood cyst on the ovary. So the difference between open surgery, laparoscopy, and robotic surgery. In open surgery, we do a big cut, which sometimes causes more pain and more problems for us in terms of adhesions and getting pregnant. It can also decrease our recovery. Laparoscopy is a surgery where we do very small incisions and we get very good results. But sometimes robotic surgery, like Andrea's case, we need a little bit more precise surgery. And this is where robotic surgery allows us to go even further and save the ovary and make sure that we don't compromise the fertility.
What I really love about the whole process is that he guides you through the different steps that you have to go through during your operation. And he gave me several options of different operations that I could do. So one was open surgery, which was out of the question considering it takes too much time to recover. Then there was laparoscopic surgery and robotic surgery. And the moment I heard robotic surgery, we went for this option. And well, I remember going into the operation, you know, this beautiful room with gorgeous state-of-the-art equipment, quite immaculate, I would say. People were extremely supportive. The staff was extremely supportive. So I remember waking up a little groggy after the operation, and a nurse tells me with his sweet voice, he says, "Andrea, we were able to save your ovary and your fallopian tubes. Congratulations."